This next section is entitled Antidepressant Medications. We will discuss which medications are suitable for which types of patients. In this section, we'll discuss antidepressant medications. Major depressive disorder, or clinical depression, is commonly treated with a combination of both pharmacotherapy and psychotherapy. The combination together has been shown to be more effective than either one alone, though mild depression may respond well to either therapy. Lately, electroconvulsive therapy has also been shown to be effective and is used in cases of patients that are refractory to pharmacotherapy. There are many different classes of antidepressants. We'll be talking about the following four classes: the monoamine oxidase inhibitors, or MAOIs, tricyclic antidepressants, selective serotonin reuptake inhibitors, or SSRIs, and the heterocyclic antidepressants. Let's talk first about the monoamine oxidase inhibitors. MAO is an enzyme that metabolizes norepinephrine, serotonin, and tyramine. MAOA metabolizes all three, whereas MAO type B only metabolizes dopamine. MAO inhibitors are older and a seldom used today class of antidepressants. The classic MAO inhibitors that you should remember for the step 1 are phenelzine and tranylcypromine. They inhibit both type A and B. MAO inhibitors are effective for depression but are very difficult to take. They can cause a lot of side effects. As we talked about before, they interact with tyramine-containing foods. The diet interactions can actually lead to hypertensive crisis, and they're contraindicated with other types of antidepressants that can cause serotonin syndrome. The tricyclic antidepressants classically include amitriptyline, imipramine, and clomipramine. They're able to block reuptake of both norepinephrine and serotonin, and they're used for many different medical problems, especially major depression. Although today, these tricyclic antidepressants are more classically used for neuropathic pain, obsessive-compulsive disorder, and enuresis, or bedwetting. Tricyclic antidepressants can also exert varying amounts of muscarinic and alpha blockade. They're very toxic in overdose. Tricyclic overdose is very commonly tested on the boards as well. It's considered a medical emergency. These patients can develop arrhythmias or in coma, as well as decreased reflexes and respiration, hypotension. It's important to remember that amitriptyline overdose can resemble atropine poisoning because of the muscarinic blockade. Withdrawal from tricyclic antidepressants, or stopping it too quickly, can cause major symptoms as well as increased blood pressure and agitation. Tricyclic antidepressants, again, should not be given concurrently with monoamine oxidase inhibitors or SSRIs because it can cause serotonin syndrome. Overdose of MAOIs or tricyclic antidepressants is considered to be much more dangerous than overdoses of SSRIs. Let's talk briefly about the SSRIs. The discovery of SSRIs in the 80s and 90s was a major advance in the treatment of depression. These medications have much fewer side effects compared to the other classes of antidepressants. The most commonly given medications include Prozac or fluoxetine, Paxil or paroxetine, and sertraline or Zoloft. These medications can selectively block the serotonin transporter, which increases the 5-HT concentration in the synaptic cleft. The indications for use of SSRIs include obviously major depression, but also anxiety states such as panic states, social phobias, things like that. So SSRIs are commonly prescribed in premenstrual dysphoric disorder, as well as obsessive compulsive disorders and eating disorders. The adverse effects of SSRIs commonly include sexual dysfunction, difficulty in achieving orgasm, as well as anxiety and agitation. SSRIs can also cause a withdrawal syndrome if they're stopped too quickly. Some other antidepressants you should be aware of include the SNRI family, which are the serotonin norepinephrine reuptake inhibitors. These include venlafaxine and duloxetine. The side effects, again, are similar to SSRIs. They can cause sweating. Duloxetine is also commonly used to treat neuropathic pain. Other antidepressants that you should be aware of include mirtazapine, or Remeron, which is a very popular antidepressant that's given currently. This is a tetracyclic compound. The way that it works is by antagonism of the presynaptic alpha-2 receptor. This can cause increased release of serotonin and norepinephrine from the neuron. These also block serotonin receptor 2A, 2C, and 3 that can contribute to the antidepressant effect. These generally have faster onset that can cause sedation and increased appetite and weight gain. They're commonly used in elderly patients. Bupropion is another antidepressant, also known as Wellbutrin or Zyban, which is related to amphetamines. It has stimulant-like effects. It should not be given in patients with seizure disorders and is commonly given as well in smoking cessation therapy. Another antidepressant you should be aware of is trazodone. The way that it works is by inhibiting serotonin reuptake, but it primarily acts as an antagonist of serotonin 2 receptor. It's used at lower doses for sleep aid, especially sleeping problems that can be an effect of SSRIs. Remember that some side effects of trazodone would include priapism, which is a painful sustained erection. This is commonly tested on USMLE. Let's talk briefly about serotonin syndrome. Serotonin syndrome is often tested on the USMLE as well. This is a drug interaction when SSRIs are used concurrently with MAOIs or tricyclics, as well as meperidine and dextromethorphan, which is a weak opioid. The symptoms of serotonin syndrome include diaphoresis, muscular rigidity, autonomic instability, which typically manifests itself as hypertension and tachycardia, as well as convulsions. St. John's wort is another antidepressant that's considered an herbal medication. The active drug in St. John's wort is hyperforin, which inhibits norepinephrine and serotonin reuptake. There are very few side effects of St. John's wort. However, it can be a cytochrome P450 inducer, so it can cause some drug-drug interactions. This is the chart that shows the major side effects associated with psychiatric medications. And as you can see, the acute dystonic reaction, serotonin syndrome, and neuroleptic malignant syndrome can have some things in common. For example, they can all cause myoclonus, they can all cause restlessness or agitation, they can all cause hyperreflexia. However, only the acute dystonic reaction will cause trismus, ocular gyrocrisis, and dysarthria. Only neuroleptic malignant syndrome is known to cause leukocytosis, myoglobinuria, and elevated CPK. Let's talk about the therapy of bipolar disorder. The treatment of bipolar disorder is much more difficult than the treatment of depression. What's important for you to remember is lithium is a first-line medication for bipolar disorder. Other medications that can be used are valproic acid, carbamazepine, and lamotrigine. Lithium works by changing the balance of cyclic AMP and phosphatidylinositol inside the cell. The mechanism of action of lithium is very poorly understood, but we know that it modifies neuronal signaling in muscarinic and adrenergic neurons. Lithium can act like sodium and bind ion channels as well. It has a long half-life. Patients that are on lithium need to have their plasma lithium level monitored. The side effects of lithium are very important to remember.